guys, welcome to my YouTube channel. If you clicked on this video because you think you will hear me say cesarean section is easier than vaginal delivery, then my dear, you are in the wrong place. So this is not that video, and I do not usually say abominable things. Like, that's not how I roll at all. I'm hoping that you guys cannot hear the noise outside. If you can, please forgive me. I'll try as much as possible during post edits to remove all of it, but if it's not possible, bear with me guys, please. I'll try to speak really loud so that I'm above the noise. But yeah, I was saying that I had a vaginal delivery 2 years ago, and that experience scarred me for life, and I am currently still recovering from a cesarean section that I had in June. This is November. We are in the first week of November, so 5 months. 5 months, guys, and I am still not myself. And I'm not even talking about 100% myself, pre-baby myself. I'm talking about just feeling okay in my body overall, and there's no pain, no headache, no this, no that is as a result of that experience. I am not myself 100%. My health used to be something that I was very, very sure of. Like, come rain, come shine, I am almost always okay. But recently, that has not been the case. That's not been the case at all. But that's not what we are here to talk about, right? My people will say, betanu, betanu, na hunama. If you are able, I think you understand what I'm saying. If you are not, I'm not sure how to translate it. But I don't think that comparing myself to a cow is what I had in mind. But that's the closest reference that I could draw from. It just means bring meat on the body of the cow. That's what it translates to. But you know how proverbs are. You can just apply it to whatever situation that you are going through at the time. In this situation, I'm talking about childbirth, pregnancy, delivery, labor, all those things. People try to compare it and say several different things about it, but at the end of the day, it's the body of the woman or whoever is going through it that suffers. And I'm not sure a cow and a woman is the best comparison, but I've said it, I cannot take it back. Let's go. Let's start with vaginal delivery, pros and cons. They say you heal quickly after the process, which is kind of true if, and this is a very big if, everything goes as planned, like you don't have any complications. So pray that you don't have any kind of tearing that will eventually lead to stitching. Also pray for your birth team as well. Hopefully everybody involved knows what they are doing, and what they are doing agrees with them. If everything goes according to plan and you deliver safe and sound without any complication, they say healing is easier. I am not sure because that was not my experience, and I cannot relate because it was not my experience. After I gave birth, I had complications that they now had to start sorting out, but when they eventually discovered what the issue was and fixed the issue, I guess I started recovering quickly after 5 days. But yeah, they say vaginal delivery is easier to recover from than cesarean section. The second pro, which I think is the sweetest one, is that you don't remember the pain. That for me is the reason why people give birth to more than one, I think, because you don't really remember what the actual pain feels like. From my experience, I can remember all of the activities and all of the things that the pain made me do, but I can't really remember the pain of the whole process. I know that there are some people that have trauma that they have to now start dealing with after birth. I'm not talking about those people. I'm just talking about the normal labor pains. You don't really remember it. At least in my case, I did not remember it. But you know, it's just that kind of pain that you cannot forget. I know it's contradictory, but if you've gone through it, you know what I'm talking about. It's difficult and hellish when you are going through it, but once you push out that baby, you don't really remember your labor pain. You remember the process, you remember the experience. You can tell people all of the things that you did and all of the things that you said during the process, but you can't really remember how it felt. And this is not to say that labor is not painful, because that will be the farthest thing from the truth. I think that going through labor is the biggest pain I have had to, okay, no, second biggest pain that I have had to go through. And second, because I'm comparing it to like the loss of a child, which is like, you don't want to experience that. So labor is that painful. It's very, very painful. But the good thing, like I said, is you don't remember it. You just are happy to have finally gone through it. You're happy to have your child, and after a few months, a few years, you're looking forward to having another one. So yeah, I agree with this point that you don't remember the pain after you've gone through it, which is a very big plus if you are considering vaginal delivery. I think with vaginal delivery, the biggest thing is to get through labor and delivery. Once you've gotten through that, every other thing is easier, I think, in my opinion. Again, I'm not talking about people who have to start recovering from tear and stitches. That one no follow, like it's not among. I'm just talking about like the normal complication-free delivery. Once you've gone through that process, I guess everything after that is easier. Now let's talk about the cons of vaginal delivery. The first one, which is what I experienced, I'm not sure if it's the same thing everywhere, but at least in Africa, I think vaginal delivery is usually not handled by doctors. There are midwives and nurses that take care of that. And this was shocking to me, because in my situation, I had been in the hospital 2 weeks before I went into labor. So I had seen like all of the doctors, I was familiar with the doctors, I was just even hoping that particular ones were the ones that would be there when I would eventually want to deliver. So I had gotten familiar with the doctors, only for the doctor to come in with like a team of midwives, I guess, like they are women that would be the ones to handle the delivery. Like I did not like that. I did not like that at all. So it was like people I was just seeing for the first time, and them having to go through that process with me. I would have preferred if they were doctors that I had known or nurses that I had seen before, but they were new, and I didn't like that at all. I think this is something that you can mitigate against, like you can prepare for it. So if you want a particular midwife or nurse that you already know to deliver you, you can request for that. I think in my situation, I didn't have that choice, and I did not like the fact that they were just like a bunch of strangers helping me through the process. And because I was just meeting them for the first time, there was times where like irritation sort of came in, and they were tired of me. It was just, I would have preferred for people who I know and have been in communication with and have known me a little bit at least, to be the ones that would be there when I'll be giving birth. So yeah, that's one con. Doctors do not do vaginal delivery mostly. And the second one is the examination. God, I hated that thing with a passion. The process of them checking whether you are dilated or not, I think that should have been my number one con. I hated that process so much. I think there are people that don't mind. I do mind. I overminded. Like after they did it the first time, that was it. I was like, no, you are not gonna do it again. You are not gonna. And it was one of the things that pissed them off as well, because I was refusing certain things. I was just insisting that I could not bear for them to do certain things. So it got really difficult. But eventually, I had my baby, and everybody was fine. The third one for me is the wait. That process of waiting to your due date, and then some people stay past their due date and they still haven't gone into labor. I know that towards the end of pregnancy you are tired, like you just cannot wait for it to be done with, and every day feels like a month. So at that tail end, I cannot imagine having to now continue to wait and wait and wait, and not just being certain when it's going to happen. So I think that would have been a con for me. My situation, the weight was kind of different. So I had a premature rupture of membrane, and then they had to admit me in the hospital. So it was like a 2-week long hospital stay, and then I eventually went into labor. And in that period, it was, I don't want to say it was very bad, because they were good and they were bad as well, but it was, is it going to happen? Oh God, I pray it doesn't happen. I just, one more day, one more day, one more day. But what happened eventually happened. If I keep referencing my first pregnancy, I did like a whole video of that process. Videos. I recorded videos of the whole process and how everything eventually turned out. I'll leave them in the description box so you guys can watch them if you want. But yeah, that whole process wasn't nice. That whole wait wasn't nice at all. What happened eventually happened, but I wish that we didn't have to have that, you know, long limbo where we did not know what was going to happen. The second time around, we didn't have to wait that long. We picked our dates. We knew exactly when what was going to happen, so it was a bit easier than the other one. So yeah, but the weight I think is a con, not a very bad one, but a con still. Another con which is very obvious is that vaginal delivery hurts. It's painful. There's no going around it. There's no, it's painful. Imagine the size of a baby coming out of your vagina. It's a lot of pain. At a point, it's like from your head to your toe. You're not sure where it's going to hurt, so that you can brace yourself from it. It's just everything hurts. Everything hurts. But the good thing, like I said, in my list of pros is that you don't remember it afterwards. Hopefully your labor is not so long and it progresses as it should progress. Once you get through that, you'll be fine. Similar to the examination that I mentioned earlier, where they check how dilated you are, another thing that I hated so much during my vaginal delivery was delivering the placenta. In my case, the placenta ruptured, so like the woman in charge of delivery had to go in with her hands. Like, it was horrible. It was horrid. I'm not even going to go into more details, but I hated that. I hated that so much. That's it really when it comes to vaginal delivery. If you've not noticed up until this point that all of the opinions that I'm sharing in this video is based on my personal opinion, please do note that these are my personal opinion. It's based on my experience, what I went through, and I'm just one person out of the millions of women who give birth every day. Please bear that in mind while you go through the rest of this video and all of the things I've mentioned previously. Obviously, at the rhyme. Hi. For cesarean section, let's start with the cons. The first and obvious one is that it's a major surgery. It's a major surgery, and with any type of major surgery, there are a list of things that could go wrong. It's scary, it's intimidating, and if it's something that you've never done before, it can get really scary. They are cutting through layers and layers of skin to get to your baby, bring the baby out, and then sew you back up. So there are a lot of things that could go wrong, could be really scary. You start preparing for the surgery a day before. In my case, I was asked not to eat after 10 p.m. I think, yeah, I get into the hospital very early the next day. They run like a bunch of tests. They draw your blood just to help them prepare in case there's an emergency and to determine what your current state is, I guess. They do like the ultrasound. Like, there's just a bunch of things that they do. They also monitor your baby for a bit. They go through, there's a long list of things that they do before the actual surgery. They sedate you. In my case, I was given a spinal block and spinal freeze, I think. There are two things that they injected through my back, and for someone who does not like needles, it wasn't pretty. It was not pretty at all. Then there's the fact that a lot of the process is out of your control. With natural delivery, you, your body, your mind at like the center, the focus. You are doing most of the work. Every other person there is just there to like guide and support you. With CS, you just lay there, you cannot move. In fact, they make sure you don't move through the sedation, so you're just lying there and it feels like an out of body experience, especially if your team of doctors are just doing things without letting you know what's up. In my case, it wasn't that way. They were talking me through the process and just saying things, talking plenty things, asking questions. I had my sister with me, so it was like a good experience, I guess. But there are a lot of things that you can't control. You're just lying down there and allowing them do everything that they need to do. All you have is prayer and hope that they actually know what they are doing and that what they are doing agrees with them again. So yeah, that's what the whole process feels like, and I think it is a con as opposed to like the natural process where you are involved and it doesn't feel out of body. The third con that you can associate with cesarean section is like all of the side effects that can manifest as a result of the process. If you speak to any mom who has gone through CS, they usually have a lasting souvenir that they took out of that whole process. The most common one is back pain. A lot of people who have gone through CS will tell you that their back still hurts years and years after, and this is as a result of like the sedation drug that they give you through your spinal cord. That thing hurts like hell, and I think that that side effect also varies from person to person. In my case, I have back pain. In addition to the back pain, I also got high blood pressure. Yeah, I did. If you have watched my birth vlog, you would remember me mentioning that I had to be readmitted after I was discharged from giving birth. So in that process, they diagnosed pre-eclampsia. I think that's what it's called. Yeah, usually people get it during pregnancy, but I didn't get it until after pregnancy, and one of the symptoms of that is really high blood pressure. It was really bad. Like, I was in the hospital for days. I could not breathe. It was a whole different experience anyways. But yeah, I came out of that with hypertension, and now I have to take hypertension drugs for, I don't know. I'm hoping that it's not the rest of my life. I'm hoping that it regulates after a period of time. Hopefully it's not a lasting condition, because I cannot imagine being on drugs for the rest of my life. But yeah, that's something that I'm still recovering from even now. And there are other things as well that are as a result of that process that I'm still having to go through. So imagine people saying that cesarean section is the easy way out. Wow. The fourth con, and I think this is the final con for me, is the healing process. The healing is long and hard. The hospital will recommend 6 weeks. I think in that period you're not supposed to lift anything that is heavier than your baby. You're not supposed to do strenuous activity. You have to take care of your scar. There are a lot of rules and regulations that they give you about the treatment of your scar and what you are supposed to do and not do while you are recovering. They will give you 6 weeks, like I said, to be able to slowly get into normal activity. But that 6 weeks is just a scam, like a big scam. This is my second abdominal surgery, and I can tell you for a fact that it takes months, as in months and months and months, for you to begin to feel yourself again. Like I said at the beginning of this video, this is 5 months and I am still not okay yet. So obviously 6 weeks is not the time. It really isn't at all. So cesarean section is long and hard, and imagine having to go through that healing process for yourself and then taking care of the baby. If you don't have a lot of help, that can be hellish. I cannot even imagine people that don't have help and then maternity leave. There's just a lot of things that are associated with giving birth, but that's not the purpose of this video. Let's just stick to this one. The healing process, like I said, very hard when it comes to cesarean section. So that's the fourth and final one. Enough of all of the doom and gloom. Let's move over to the pros when it comes to C-section. The first one is how quick and fast the process is. I was in and out of the operating theater in less than 30 minutes. It's that fast. It was really fast, which is a good thing, because having to just be that out of control is really weird, so that the process wouldn't take that long is a good thing. But the bad thing about it is it takes a long time depending on what you are injected with for the sedation to wear off. So even after you leave the operating theater, you might not be able to move that much, at least from your waist down. You will still have very limited movements, but the good thing is you can carry your baby because your arms would be, you know, free. I carried my baby from the operating theater, I think. Yeah, and while they wheeled me out, so that's really really good. The process very quick. You won't even know when they start and finish. And if you pre-schedule like I did, you don't have to deal with that long anticipation. You already know when, time, date, who is doing what, where it's going to happen. So you just roll into the hospital and roll out, God willing, 2-3 days. So the anticipation and the wait is removed from the process, which I think is great. Now, if you've watched up to this point and your takeaway is that it's not that scary, stop putting fear in people's mind. You are not the first person to have given birth. Well, I agree with you. If you haven't gone through the process, I wish you all the best. Like, I wish you good luck. If you have gone through any of the processes and you still think the same thing, well, congratulations on being God's favorite. Some of us are not that opportune to have gone through labor and delivery pain-free, painless. Like, that was not my case, that's not my situation, and I'm making this video for other people who are like me, that were not prepared for what their eyes saw in that room. My own mom used to say that labor is not that painful. She was saying it as a way of encouragement, I think, to like remove the fear from our heads. And I think that she should know, because she has 6 children, 2 of which she gave birth to by herself before she could go to the hospital. So she's definitely one of God's favorites. She's definitely a superhuman. But some of us don't have that kind of strength, and those are the people that this video is meant to help. If you are a mom, let me know in the comments what your experience was like. And if you are pregnant watching this video, I wish you all the best. I wish you all the best. You can do this. You are strong enough to do this. If you have any questions, leave it in the comment section. I will definitely answer every single one of your questions and concerns. If there were things that you wanted me to speak about in this video that I did not speak about, let me know in the comment section. And if it's in my willpower, I'll definitely answer those questions. If you like this video, you would definitely like my other videos, so go ahead and get comfortable. Give this video a thumbs up if you enjoyed watching. Click that subscribe button so that you join my growing community here on YouTube, and I'll see you in my next video.